Hi, everybody. For those joining us on the webinar, we're just waiting for people to just log in now. For anybody watching the recording, there'll be about 45 seconds, a minute of silence while we're just waiting for all of our live attendees to join us for the webinar this evening. So for those people just joining, don't worry, it's not silent for a reason. We're just waiting for people to jump on and we'll get going very shortly. Okie doke, I think we're going to get going. We've got everybody joining us now. So hello and welcome everybody this evening to our webinar on soft tissue management strategies for scar therapy in partnership with Juzo. Once, thank you very much for joining us this afternoon / early evening for this session. Now, the session is going to be split into two sessions. We have a couple of presentations from myself, Dilesh and Hannah that join us this evening. And then we're going to move into a question and answer session at the end where you get to pose any of your questions to each or every one of us. So just a little bit of housekeeping from the start. The session is being recorded, so which you'll get access to after the session when we send out a link along with the survey. If you do have any questions, there is a chat function which you can find at the bottom of your screen in the Q&A section. So pop any questions in there. You can interact in the chat area as well. For anybody who's watching the recording, if you do have any questions you'd like to send in, then please send it in to info@physiequip.com and we will get them answered for you. So a very quick introduction to us at PhysieQuip. So for those of you who don't know, we're a UK-based company who specialize in MSK medical technology. Our aim is to bring some of the best technologies from around the world into the UK, and not only just technologies, but some of the best practitioners from around the world, but also the UK, to our education platform to offer you something a little bit different. I'm going to leave the introductions of Dilesh and Hannah to themselves when we get onto their presentations. What I'm going to do is I will crack on with the first part of our presentation into soft tissue management strategies. So first and foremost, we'll look at soft tissue management and what it actually is and what it even means. And so just to have a bit of background about what it is. So this is a model that PhysieQuip have been working on with the Johns Hopkins rehabilitation department. So anybody who doesn't know Johns Hopkins, is one of the biggest hospitals in the States. And this model is basically an approach to understanding how different techniques in soft tissue management actually work together. And we look at incorporating them all into one strategy, all into one structure, because we've got all these amazing toys and wonderful tricks that we can do, but actually how can they work together? All of this is completely underpinned by the phase of healing. So depending on which technologies you have available and what treatments that you have available, you have to understand your phase of healing. So when your patient is presenting, you know where they are, and that is going to help direct what treatment modality that you're going to apply for that particular person. So it's really important to not only understand the phase of healing, but also understand the technology or the treatment that you're looking at as to at what point that is the most effective. And then this is your treatment structure and how the whole soft tissue management strategy works. And there's three pillars of treatment. You've got mechanotransduction, decompression, and then biostimulation. Mechanotransduction, or what we call deconstruction, and decompression or decongestion are interchangeable, again, depending on where that patient is in their healing process. And these are, we'll break this down in a moment as so you have a better understanding of which technologies fit into each. And then you have biostimulation as well, which is part of that. Now, this can all be done in one treatment session. It can be done across different treatment sessions. And the real important part is all of these three pillars are underpinned by movement. So at any point during these treatments, we're encouraging patients to move. We're encouraging that increasing range of motion, whether it's stretching or anything like that. So all the time we're trying to increase movement. And the other thing we're looking to do is break this pain cycle. So 9 out of 10 patients in clinic will present with pain. Usually that's why they're walking through the door, they are in pain. And then 99% of the issues we see, I think we could probably argue at 100% or 10 out of 10 for these, but 99% of the problems it will face will have some impact on soft tissues. And what we're looking to do is break this pain cycle. So when people are in this pain element, they get altered movement, altered muscle recruitment, abnormal tissue loading, microtrauma, release of chemicals, and it just keeps going on. And particularly with scarring, it really highlights some altered movement patterns and these pain cycles. So it's how can we manage with this? And then looking at, obviously, specifically with scarring, we're looking at the issues with wound healing. Now, that mechanism, those phases of healing is a best case scenario. If everything goes well, everything should be fine. However, when we look at the initial stage of inflammation and homeostasis, that's just basically at the point to prevent any further damage or infection, and it can lead to a less than optimal result, which is obviously evidenced by scar tissue and adhesions, which I know Hannah sees a lot of. Now, the larger the wound, the larger the injury, the more likely there are going to be some complications during that whole healing process. So when they're going through that healing process, how can we make that more efficient? But if we have got something that's more complex, how can we either reinitiate or help those patients in those scenarios? So when we look a little bit more at mechanotransduction, this is our most uncomfortable stage of treatment. So you can control the intensity of the pressures used. And the whole idea is to exacerbate the inflammatory process in chronic pain. And it's all about facilitating the physiological process where cells sense the response to mechanical load. So we know tenocytes, chondrocytes, fibroblasts, endothelial cells are mechanically responsive. So we want to be able to stimulate them mechanically, get them activated to improve those tissue healing responses. And it's all about sort of turning that collagen 3 to collagen 1. And some of the techniques that you can use and some of the treatments that you can use that come under this umbrella are things like shockwave, instrument assisted, high level negative pressures, needling, acupunctures, anything where it's creating a mechanical stimulus that's quite an aggressive stimulus that's trying to stimulate a response in the tissues. Then we look at decompression. Now, this is much more comfortable because there's less stress. So you can look at this at gentle manual techniques, and this is looking at mobilizing fluid. So how does this work with mechanotransduction? Well, if we're stimulating an inflammatory response, then immediately after we can then help decompress the tissues and flush that out. So where we've initiated some inflammation, we can help with that. And the whole point is to help support proliferation at these stages. And you can use this in acute or, like you say, after mechanotransduction. And some ideas on the techniques that you could use: a manual lymphatic drainage, really nice, easy, hands-on. Again, you can use intermittent negative pressure, kinesiotaping, compression or pneumatic compression, some cryotherapies as well work on this. Obviously, there's a little, there might be more treatments that can fit into this stage as well. And then finally, we've got biostim. So this is probably the most pleasant of all the treatments. So you can see how we're working through this more aggressive down to much more tolerable. And this helps with analgesia. You can use gentle warming, particularly with photonic lasers, stimulate mitochondria and protein synthesis, and ultimately stimulate cell response. And looking at the techniques, we're looking at lasers, low-level light therapies, electrostim, TECAR therapy, and again, other treatments are in that as well. And then finally, looking at movement integration. So this is where we're looking at active, passive, or resisted movement, and this can be during our treatment. So it can be during a shockwave treatment, it can be during laser treatments. You can integrate movement, active, passive, and resisted, depending on what that patient can actually do. And it's a really nice paper. I'm sure we've probably all come across this now, is optimal loading. So we want to find that optimal level of load that we can put somebody's tissues through. So that might mean that we have to look at taping, bracing, or other movement aids. So we want to try and encourage movement, not necessarily mobilize certain things. I know there will be certain injuries and pathologies and indications where you have to completely immobilize. However, I know there's plenty where we can encourage some level of optimal movement. So that's me in soft tissue management in a nutshell. So hopefully that just sets the scene of how we can utilize lots of different technologies and try and put it into some form of structure. What I'm going to do now is I'm going to hand over to Dilesh, who's going to introduce us a little bit more to laser therapy and how you can use their system. So Dilesh, you now have control of the presentation. Over to you.
Thank you, Dominic. Appreciate the opportunity today. My name is Dilesh. I represent Juzo, and I am the regional business consultant for the Southeast region. Juzo is the official UK distributor for PowerLaser Pro. However, it is manufactured by PowerMedic Lasers based in Denmark. So just a little bit about what is low-level laser therapy. It's basically the application of red and near infrared light. It's applied to the direct surface skin of the body with the intentions of decreasing pain and inflammation, promoting healing of wounds, tissues, and nerves, and preventing tissue damage. It's also applied to the skin surface, which allows the light to penetrate deeply through, and it basically goes directly through to the other side. It's different to high-level lasers such as class 4 lasers, which are known more commonly for surgical procedures, as these basically cut and destroy unhealthy tissue. This is just a basic diagram of how the mechanism of laser therapy works in tissue. With laser treatment, the energy from the laser light basically is transferred into the cells of the body where it can be used as fuel. Its unique characteristics and energy, the light penetrates deep into the tissue and into each individual cell and mitochondrion. This is where the energy is basically absorbed and therefore transferred. The cell basically gets the energy to perform the task it's already programmed to do. Into its natural healing process, basically. So, for instance, if the laser is applied to an injury, the result is basically an acceleration of the body's natural healing process. What can PowerLaser Pro treat? That's just an example of what it looks like, but it can treat anything pretty much with an inflammatory element, such as soft tissue injuries, radiotherapy, scar therapy, tendinopathy, muscle fatigue, endurance, strength and recovery, pain management, arthritis management, wound healing, including burns, scars and plastics, lymphedema, and veterinary as well. How do you use our lasers? There are a few contraindications that do come with the laser, and obviously it's wise to sort of observe the protocols in the safety procedures provided with the manual. But the contraindications would include epilepsy, pregnancy, cancer, and heart problems. You can use it with caution, such as with birthmarks, tattoos, dark skin, dark hair follicles, and it's completely safe to do so on any patients that have pacemakers, implants, screws and plates, and epiphyseal discs. But obviously follow the PowerLaser Pro treatment protocols, and it would all be highlighted in there. One of the lasers, the PowerLaser Pro 500, has a maximum power output of 1,000 milliwatts. There's a little diagram of what it looks like. It's basically a class 3B portable laser, which is hyperpulsed. What this basically means is that the energy is delivered in impulses with a higher output of power. This ensures a deeper penetration and a more effective therapy without a risk of burn. It has 3 time and power settings, which can be sort of adjusted to meet the needs of your patients. Basically allows you to customize your therapy. It's quick, effective, and it's a lot easier than using it to other LED lasers. It's the ideal treatment to target more specific muscle groups such as acupuncture and trigger point, as you can see there in the bottom right hand. It has interchangeable pointed tips, and it makes it more easy and more possible to treat harder to reach areas. It has a lithium battery powered for prolonged use. You can probably get about 3 hours of use out of this laser with a 2-hour charge time. It has a built-in hi-fi noise and vibration, which basically tells you when the laser is actually on, just for safe using, and obviously it shows you the light indication to toggle between the programs itself. Similarly, the PowerLaser Pro 1500 has a total max output power of 3,000 milliwatts. It's obviously a little bit bigger with 3 diodes on it. It's a sort of picture there for you. But again, it's a 3B portable laser, which is hyperpulsed. Obviously, the energy is delivered in impulses with higher output power. And this obviously penetrates deeper into the skin with a more effective therapy without the risk of burning. It has 3 time and power settings, similar to the other one. Allows you to, again, customize your therapy for your patients. This is slightly bigger, as mentioned earlier, which has 3 laser diodes on it, which is why it's a 3,000 milliwatt laser, which means you do not need to move the laser around as often, as you can cover a larger surface area. It's perfect for treatment for medium-sized muscle groups, as you can see the clinicians using it on the back there. It's quick yet effective treatment time compared to other LED lasers, and again has the lithium battery, which allows prolonged use. So in conclusion, laser therapy is clinically proven. It's less invasive. It's an alternative form of treatment which can be applied to a wide variety of areas, including soft tissue injuries, scar therapy, physiotherapy, orthopedic, veterinary and equine. It's the more low sort of cost-effective treatment that complements many other treatments to improve the overall results which you can get from your patients. The PowerLaser Pro is very competitive in price. It's very effective, very portable, easy to use, and again, it's very powerful. We are confident that it's one of the better lasers to use in the market, and we are totally comfortable and confident with the fact that we will get results with this Class 3B laser. Okay, thank you very much. That's it from me.
Perfect. Thank you very much, Dilesh. So hopefully it's given people a bit of background about some more technical info on a laser. Now to hear from somebody who has experience with laser and other systems as well. Hannah Poulton, also scar specialist. So here to present some case studies and things. Hannah, the screen is yours. Away you go.
Thank you so much, Dom, and thank you, Dilesh. That was really interesting to listen to about, yes, the device that I've been using in clinic. So yeah, thank you very much, and thank you for having us, Dom and PhysiQuip. It's great to be on board. My name is Hannah Poulton, and I'm a senior physiotherapist, a scar therapist, an acupuncturist, and a mummy MOT practitioner, and I'm an advanced rock tape practitioner as well. So I'm more on the clinical side, and I've had the privilege of using both devices, the LymphaTouch from PhysiQuip and also the Juzo PowerPro laser from Juzo. Let me just see if I can move my screen up. There we go. So I'm just going to go through today with you very briefly 2 case studies that I use both devices on, with before and after photos, and then clinically reason with you why I chose to use these devices as part of my manual therapy. Now, I've been in physio for about 20 years, and it's only very recently that I'm starting to use medical devices more to enhance my treatment, not only to get better results, but faster results for my clients. So that's just a little bit about me. HLP Therapy, based in Leicester. I offer all these services, and my team offer a wider services such as massage and pregnancy massage and Pilates as well. But it's just myself that uses the devices currently as part of my physiotherapy and scar therapy treatment. And the clients that I've got, the before and after case studies today, are specifically scar related patients. So my first case study that I want to share with you is an amazing 13-year-old girl. She had pain in the back of her knee. She plays football at a really high level, and they thought she had a football injury, and she came off the pitch with knee pain. It just so happened that she had a tumour in the back of her knee, and unfortunately that had to be removed. And the scar looked very neat right at the beginning, but then unfortunately went from a hypertrophic scar, which is a scar that unfortunately the body produces more and more collagen on top of the scar, where you get that red raised appearance, to a keloid scar, which meaning that the raised scar then goes beyond the boundaries of the scar to go wider and wider. And you'll see in a moment from the pictures why this was a problem. So of course she's a young girl, it's on the back of her knee. Aesthetically, she didn't like the look of it, but more importantly, it was causing real problems with full extension of the knee, and also the emotional impact of having a scar of this size. So what did I do in terms of my treatment with this client? Well, as we know as clinicians, a holistic assessment is vital at the beginning of any assessment with your client. You need to look at their posture, their moving, their breathing, their function, their range of movement, their pain levels, before you've even started to look at the scar and how you're going to treat that. So we went through everything. And especially being a young girl with a big scar on the back of her leg, we had to take time with that emotional response. You will know yourself, if you have a scar or a mark that is thoroughly visible, you might be self-conscious about that. And also, as you look at the scar, it might bring back the emotional aspects of how you got that scar, whether it was a traumatic surgery or whether it was an accident that you were in. So of course, in your assessment, you need to take your time in order to let those emotions come out as part of the healing process, as you would do with the physical. You have to acknowledge the emotional response as well. Of course, I use my scar therapy skills along with mobilization, stretches, a series of exercises for the client to get that range of movement. But of course, full range of movement wasn't possible because this wasn't a joint problem. This was a scar problem. As the scar contracted, it stopped getting full knee extension. So that's when I use my scar therapy skills. So we worked in with the scar and across with the scar in an eraser type motion. We worked deep into the scar with working with our fingers deep into the scar to try and get more blood flow, to try and smoothen that scar, to try and change the behavioral nature of the fascial connections underneath the scar. We also use things like silicone gel over the scar, and the key to getting that range of movement and definitely loosening that scar was using the LymphaTouch machine. Now, because it was a new client and a new machine to me, I started off with low pressures around 80, and then very quickly I could see how the client was responding. So I saw her once every couple of weeks, and I increased the pressures every week in multiples of 20 or 40 to go up all the way up to 180. Now, I would advise anyone who's starting to use the machine, proceed with caution, see how your client responds, check the tissues, check the comfort of the patient, how they're responding to that in the global sense. And as you get more confident with using equipment, and obviously the patient gives you good feedback, then you can start to increase those pressures to get a better response. Not only did I work over the scar with using the LymphaTouch, I worked around the scar. And as Dom quite rightly said at the beginning, it works on those 3 different treatment modalities, bringing together that decompression, flushing out, the movement underneath, the increase in circulation, the changes in the tissues underneath the surface. Things that we as manual therapists, as physiotherapists and massage therapists cannot do with just your fingers alone. And I know that might be a controversial statement to make. However, having the support of a medical device with you can influence those tissues underneath the surface. And with all the vast variety of treatment cups that come with the LymphaTouch machine, I use the medium-sized cup, which was perfect to fit over the scar and also round the scar. So of course, let's see the finished product, as we said. So this is how the scar on the back of the young girl's knee was first after surgery, and after about 6 to 8 weeks looks, very good in terms of healing and neat. Unfortunately, this is how it started to end up. And as you can see, not only is the scar widening, it's also going beyond the borders of the scar hair. So we get multiple different areas of the scar. It goes from keloid to hypertrophic, back to keloid again, and keloid at the end. And it's widening. Now, in this first one, you can clearly see about the lady was unable to get full knee extension. And she was probably about 20 to 30 degrees off full knee extension. Now, this is when she came to see me in clinic. And this was after the first treatment with the LymphaTouch device. As you can already see the color changes within the scar. So bright red here, and as you can see, it's starting to blend in to the surface. And what I did with the LymphaTouch was work around the scar first of all, to get that blood flow, to get those tissue changes, to change that behavior of the fascial connections underneath the surface of the skin. And you can already see straight away how it started to calm down, blend in, not be so red and raised. However, these big target areas at the top here and at the bottom were really tricky to treat, and they took a little bit longer. But can you see already that her knee is nearly straight? And then this one, after the second treatment, her knee is completely straight. And can you see now that actually the scar is fully starting to blend in with the back of the knee? We called it the button, still got this button at the end where it was raised. And that's all part of the healing process as well, to acknowledge the scar, name it, almost become friends with it, so you can start to get it to be part of your body and not be disconnected from that. So desensitizing it, touching it, engaging with that scar is so important, especially in the early stages. And I forgot to tell you right at the beginning, as part of the case history, this young girl's scar was nearly 10 weeks old by the time she'd come to see me. So still in the early phases, you know, just after that 6 to 8 week window. So we're going on to be a maturer scar. However, scar takes up to 2 years to reach maturity, so we had plenty of time to make those changes. And if you can, with your clients with scars, get in after the 6 week window when everything's healed, there's no infection and the scar is closed, to really make a difference and start to see. Now, unfortunately, I think I got a bit carried away. It's not all on the bottom here with both of these scars, but you can see already the difference. That button has started to disappear. The skin changes, it started to be blended in more within the leg itself. And this scar here is what it was last week when she came into clinic to see me. You can actually see the LymphaTouch machine has helped decompress that button on the end of the scar. No longer is it red or raised or dome-like, causing, you know, problems in terms of physical touch with that, in terms of the emotional aspect. You can see it's decompressed. You can now see as well the scar is starting to blend in with the skin, those skin changes. Of course, the color of the scar is no longer red, it's no longer raised, and it started to blend in with the leg, which is absolutely fantastic. And after 4 treatments, I can safely say I'm not sure if I'd have been able to achieve that with just my hands-on therapy alone. And of course, you can see that she's flat on her tummy on the bed, and you can see the leg that is completely flat out as well, because we can gain full knee extension. So that was using the Juzo that was using the LymphaTouch, beg your pardon. And now I'm going to talk about using the Juzo PowerPro laser. So I worked on a lady, 49-year-old lady. She had a Dieppe flap scar. Now this scar is going from hip to hip, and you obtain a scar like this when you have breast reconstruction surgery, and they use the muscles and tissues and fat from your tummy to actually reconstruct the breast tissue. So it is a major surgery, not only in terms of time and impact on the body, however, the emotional impact of having such trauma. Obviously, you've experienced cancer, you've gone through that, you've had your breast removed, and now obviously you've got a huge scar from hip to hip using your tissues to reconstruct your breast. Now, the lady came to me, she was just over that 2 years in terms of the scar maturing to come and see me. And as you'll see from the photo in just a moment, the scar was very red, it was raised, it was tight, it was itchy, it was painful, it impacted absolutely everything. So in terms of moving, bending, lifting, in terms of the emotional aspects of the way she looked, she was very fit, she was a horse rider, she liked to socialize and go out. So actually to have this scar was a big deal to her, as it would be to anyone. So how did we treat this lovely individual? Again, holistic assessment. We went through everything in terms of the treatment, how that affected her, having cancer, how she felt about the recovery afterwards. You'll notice in a moment from the first photo that the scar was incredibly dry. She herself was dehydrated, and it was looking at globally how she was. Her posture needed work on, stretching around the scar, diaphragmatic breathing, really engaging with that scar and connecting that body back again was so important. It was almost like she was two separate people and we needed to bring that together. So we worked a lot on the emotional aspect, a lot on desensitizing that scar, gently touching that scar first of all, very gentle, light, hands-on therapy. Before I considered using the Juzo PowerPro laser. Now with this one, I used the 1500 laser, so that's the one with the 3 lasers. Not only was it more beneficial for the patient because of the power that it delivered, also comfort to the patient, and you'll see in a minute why. If you're listening to this and you have a client with a really raised scar, then the single-headed laser might be uncomfortable for that client because of obviously using it directly on it with a small laser head. Whereas with the 3 laser, if it's appropriate and you've done all your risk assessments and obviously noted the contraindications, the wider laser actually works so much better round the scar, almost encompassing the scar. With the lasers, you can get the scar going through the middle. So the lasers come all directions, which was fantastic. It's gentle. It doesn't, it doesn't hurt. The feedback from the client was amazing in terms of comfort, time, but also the results that she saw. So we treated her twice a week, so on a Monday and a Thursday or a Friday. We used, yes, the 1500 PowerPro with the 3-headed laser for about 10 minutes on the P2 setting. It was great, it was quick, it was easy, and we used everything else in conjunction as well. The stretches, the hands-on scar therapy, the massage techniques, the breathing, the hydration cream and stretches. And let me show you the results. So this is the results first of all up here. This is what her scar unfortunately became like after surgery. As you can see, it looks angry, it looks red, it looks raised, and it was like a rope going across. And if you had that on its own from hip to hip, regardless of having then breast reconstruction surgery as well, you can see how this would impact absolutely everything in your daily life. So we had to be very careful. We first of all hydrated those tissues. You can see how dry they are. We desensitized them because you can see how red and angry and aggressive they look. And now it might make more sense why the single-headed laser was not appropriate for something like this. However, the wider laser to target both sides, absolutely fantastic. Now, as you can start to see, it's a bit blurred because I've had to zoom in, but here, and this is the final one, even though this looks worse than this one, I can assure you the difference is fantastic. And you can see how it started to disappear within the skin. Bit like the lady with the knee scar on the back. You can see how it's less, the tissues are less angry and inflamed. You can see actually how the borders of the scar are starting to blur the lines within the skin. Almost the body is absorbing the scar itself and getting that smooth appearance. And of course, less pain. So less pain, also emotionally having more confidence in the scar and more confidence in moving, posture and breathing, which was so critical to her overall healing. And hopefully you can see in this one as well, almost how it's starting, the scar is starting to blend in all the way from her hips and across her tummy. Now, I messaged this client to double check that she was okay with me still sharing this information, and she'd been to see her consultants this week, and they were so impressed with the scar and the difference it had made. They were thinking, you know, do we operate? Do we cut out the scar and try again? Huge, big surgeries, which now they're saying, no, let's hands off. Let's see how the body's changing. And it will be interesting in another couple of weeks to see again how her scar is changing, because it won't stay like this. It will keep, as we know, with the laser therapy, your cells are reignited, that healing process is continued. It'll be interesting to see in a few weeks just how much better it is from this scar. And this is what you can see on the side. It's not so red, it's not raised, it's not angry, it's not, you know, that bright red. And you can see how it's blurring, almost blurring the lines into the scar. And obviously laying on full extension on her back, able to take a deep breath without any pain, the first time in years, which even that on its own is fantastic. So I am thoroughly impressed with both the LymphaTouch machine and the Juzo PowerPro laser. I have them both, been using both of them in my clinics. And going forward, what I'd encourage you as a clinician, if you are working, you know, in private practice or in the NHS, then always use that holistic approach. Use the devices as part of your treatment. Still maintain your skills to get that overall fantastic outcome for your client. I'm going to be looking at more case studies using the devices, and also a variety of scars as well. We know a scar is not a scar. Every scar is different. Every story is different from the client. So how can I continue using these devices to impact scar recovery? We'll watch this space going forward, and I will share that with you at another time. Thank you very much for listening. There are all my contact details should you wish to contact me in regards to anything that I've talked about today. I'll be happy to answer your questions. Thank you very much, Dom. Thank you very much, Dilesh, for listening as well.
No, thank you indeed both for your presentations. So with those completed, we will now go into a Q&A session. So for those who are on the live session, there is a Q&A button. It can be found on the top or the bottom of your screen. Any questions, please pop them into there. I'll be watching it closely and sending those questions to Hannah or Dilesh. If you do send a question in, please just let me know who you would like me to direct it to. To kick us off, though, we do have some pre-submitted questions from people who couldn't make the live session this afternoon. So first and foremost, actually, Hannah, I just want to come to you about, because obviously we're talking about two specific devices here.
Yes.
But you know, I know that you've got other things in clinic, and I'm sure that plenty of other people have other things in clinic, and LymphaTouch and laser is not the be-all and end-all. So can you just give people an idea of what else, or what other, I hate saying the phrase, but what other tools in the toolbox do you have?
Oh, I love my tools in my toolbox. It's so good. In terms of practical tools that I have, I do rock taping, so advanced taping, and I use taping for scars as well. And I didn't use taping with these two individuals. However, that could have been good to enhance treatment and keep that treatment going. So I do use taping for some of my C-section scars that I work on as well. And I have open heart surgery scar that I use tape on as well, which is always really effective. And also I'm looking at acupuncture as well in terms of scars and scar healing to help with that pain, to help get more circulation, blood flow into that area to reignite, a bit like, you know, what the Juzo laser does to reignite those cells under the surface and help with that healing. So yes, so I work with that. And of course, course, lots of products for scars, silicone pads, silicone gels. I work with Juzo to use their ACS midline bands, which are great for compression around your thorax and your tummy and your C-section scar, to help with diastasis recti and also compression over some very raised and tight C-section scars. So yeah, so I work a lot with different products, oils and creams as well. Alhydran to help moisturize the skin because it's known for scar recovery, and Medihoney as well. So yeah, so a variety of tools in my toolbox. But, you know, 9 times out of 10, you go back to basics, Dom, don't you? What did you learn? You know, hands-on, assess the patient, say what you see, assess them as soon as they walk through the door, look at that posture, the breathing, exercises, strengthening, core strengthening, and also get the feedback from the client. What do they like? What don't they like? What works? What doesn't work? And change your treatments so they're tailor-made to the client.
Yeah, I mean, on that, actually, it's kind of like, what has been the patient feedback? I mean, is it not necessarily individual devices, but actually just the fact that you're using multimodalities? What's the feedback been?
So when I opened my business, I wanted to be different. I just didn't want to be a physio, and no disrespect to my physios. I love you, 20 years in the business, love you. I just didn't want to just do exercises and send people on their way. So I wanted to make sure I had the best and the most up-to-date and current technology in my clinic so that clients themselves saw results quicker. And whether it's a society that we're in today, whether we're more technologically minded than we used to be, maybe technology has advanced so much within health and the health sector that actually clients almost are disappointed when you don't use something else other than just your hands. Whether, you know, part of it is a placebo effect. You're bringing something out, they can see the LymphaTouch working, they can see the tissues moving, they can hear the sounds, they can feel it. You know, whether that is part of the healing process, who cares? Like,
it's discredited though, isn't it? Because
right, exactly.
Same with laser, isn't it? It's like you feel a nice warming effect, and
yes.
there's be an impact on your nervous system as well. So
definitely,
I think definitely.
Yeah, you're working on all your senses. You can see, you can hear, you want the results. It's part of that engagement with treatment. You build up the therapeutic relationship with your patient and client, you know, you're a therapist. So yes, so why not? However, they want to see results. And that's the bottom line. And when you see results, then you know you've got the best equipment in your clinic.
Perfect. I've got a question come in, Hannah, for you.
Yes.
What is your clinical reasoning process for using LymphaTouch laser or any other modality?
So my clinical reasoning process for using anything would be in this type, in terms of the scar, how do I want to influence the scar recovery? So let's go with the girl with the scar on the back of the knee. Okay, it's tight, so I want to loosen that. How am I going to loosen that? I need to get more blood flow into the tissues. I need to change the behavior of the fascia. Okay, how can I quickly, safely do that? Yeah, the LymphaTouch machine. So I clinically reason the pressures that I want to start at. Brand new patient, new machine, young girl, let's start at low pressures, build up and see how the tissues respond. Exactly how you would clinically reason anything with, providing massage, providing trigger points, providing, exercises. What do you want to target? So I wanted to target getting the scar relaxed, more mobile, less pain. How am I going to get less pain? Okay, so I'm going to desensitize the scar. I'm going to get the LymphaTouch machine to help get fluid, movement in the scar, work around the scar, help get better knee extension. So of course your hamstrings aren't so tight, your gastrocs isn't so tight, your soleus isn't impacted, and use the machine in conjunction with stretching, mobilization, exercises, gentle hands-on therapy. And the same especially with the lady with the Dieppe flap scar. What was the first thing I wanted to do? Right, we need to desensitize this. So first of all, I used my hands-on. I used the emotional response, getting the client to talk about it, hydrate the tissues, hydrate the area. Let's get that more flexible, more movable, first of all, before then we get the PowerPro laser in. And also emotionally, it wouldn't have been right to come on straight away, get in, get the laser on you.
Yeah.
Let's work together, and then let's start to use that. And I use the settings on the PowerPro laser low first of all, and started to work up in terms of time. So started with low time and then working up, you know, to 10, 15 minutes.
Yeah.
And work through that. If that, sorry, does that answer the question?
No, I think that answers the question. I wanted to add on to the clinical reasoning side of things. It's one of the reasons why I really like that soft tissue management model. And
yes.
You know, I'm not claiming it's not mine. You know, it's the best things are the ones that you steal. It's, I think actually, with whether it's devices or whether it's different techniques that you have in clinic, is that I've found with that model is you could get probably every different device or technique into one of those pillars. Yeah. And same with movement integration, you could get it into one of those into those categories. I think once you figure that out, you can go, okay, well, if it's mechanotransduction, when you look at the healing process, you're thinking, right, mechanotransduction, you're providing a physical force to try and re-stimulate inflammation. Well, you're not going to be using that really on anything too chronic. Too acute. Sorry, you're going to be looking at more that subacute chronic stage. And I think when it comes to clinical reasoning, it's the same with the laser, and I'll bring Dilesh in a second for some technical side of things. It's just, you've got to understand that device, and you've got to understand what it's doing, and also lean on your distributors and lean on your, you know, your Juzos and your PhysiQuips and whoever else, and, you know, find out exactly how they're using it. So Dilesh, just to come to yourself with just from the laser perspective, because I'm not too flush with knowledge in laser, but just for those people who are not entirely sure, like, how does like the Juzo laser compare to like other lasers and the different classes? Are you able to sort of divulge a little bit more on that?
There's several lasers available in the market. Obviously, there's not much knowledge around the Juzo PowerLaser Pro from a lot of clinicians that I've spoken to. But after sort of showing them, I just happen to have one here right now with me. But as you can see from the device itself, it's, you know, from some of the device, I'm not going to slate anyone, but by looking at the device here, you can see that it's really small, really portable and very easy to use. And the amount of cleaning going on right now as well in between patients, as you can see, everything's on the outside there. It's just so easy to wipe everything down. You know, this is the single touch 500 PowerLaser Pro 500 that Hannah alluded to earlier, with the single point laser there. But as you can see, obviously it's very small. It only weighs about 6.5 ounces. And you know, with, you know, clinic times around 3.5 hours, you can get a full use out of one charge on one of these devices in a clinic. So, you know, with in comparison to everything else out there being plugged into the wall and can't actually transport it around, this is probably one of the main class 3B lasers available. And that's why I actually said that we're pretty confident that we have two of the best lasers in the market.
Yeah. I mean, in terms of like, there's low level light therapy. That's different to laser. I don't know.
Low level light. So it is, because this is obviously, you know, this emits a class 3B laser. It's not exactly, it's a lot. Yeah, does it? Obviously, it has a classification, needs a clinician to use this. We can't sell this to the public. So it wouldn't, whereas an infrared light, it would be, you'd find that in a DVD player, you know. So as it's classified as a 3B, it'd be a lot more powerful than what you'd find in an infrared light, effectively.
Cool. And in terms of like people who can use it, so Hannah's a physiotherapist, so there's going to be people out there like myself who are graduate sport and exercise therapists who, you know, not healthcare professionals. That's another thing we'll get onto another time. But so with who can use it, like
any clinician, you know, specializing in scar therapy, in physio, clinicians in the NHS, private facilities. We pretty much sell this to a lot of private customers. The bulk of our customers have been private, working on these devices. But more recently, I've had a lot of traction in the NHS as well. Obviously, there's a lot more protocols in place, safety assessments that need to be taken, risk assessments, insurances and stuff like that, which we can obviously provide the information to, because we've now got everything available to us in order to do that. But it's pretty much available to any clinician working on patients. We just wouldn't sell this to a patient directly.
Right. And then I'll bring Hannah in again from this perspective, because obviously from LymphaTouch and laser side of things, like we've got treatment protocols. You mentioned before about having treatment protocols. I mean, they seem like relatively simple devices to use. I mean, the less you've got treatment protocols, yes?
Yes, we do.
So
it's all available in a manual that we provide with the laser.
yeah, same thing pretty much with LymphaTouch. But
Yeah.
Hannah, in terms of like using these day to day, like how was it for you when you first picked the thing up going, I have no idea how to use this? Like, yeah, I'm really comfortable with using this now. How long were those kind of learning curves?
I think it's dependent on on the experience of the clinician, isn't it? And how often you use the device. Are you in clinic every day, or actually are you in just once a day, once a week or something like that? For me, my clinics I'm full time, so very, very quickly within the first week of using it, time after time after time on clients, you get into that rhythm of understanding a device, don't you, of what it's capable of. You start seeing the results, thinking, oh, actually this can really help. And yes, I mean, I don't just use it for scars. I use it in my musculoskeletal background as well. So yes.
So the question that's come in, which was
fantastic.
MSK conditions as well as scars, because someone uses it really well for edema management. So,
oh my goodness, yeah, manual lymphatic drainage, as in like an add-on to that. So my massage therapist wants to get her hands on the LymphaTouch because she does manual lymphatic drainage for me by hand. And of course now here am I with my with my LymphaTouch going, look at that, I can do it in half the time with just as good, if not better results. Not that it's a competition at all. But yes, if you want to get more range of movement, you want to get fluid moving around the tissues, then why wouldn't you work into a frozen shoulder? Why wouldn't you work into somebody that, might have had, ACL reconstruction of the knee, and, 6 months down the line, they still don't have great movement. Those kinds of MSK conditions, lower back pain, working right into your back, get them in, flex position, pillow underneath your hips. So you're like this, start to actually work in, do some mobilizations of your spine. What a great adjunct to your treatment. So yeah, it's not just scars, it's MSK as well. And yes, with both the LymphaTouch and the PowerPro laser, in answer to your question, Dom, in the first week, it was like they've been part of my clinic for right from the beginning. So yes, and now I wouldn't be without them.
And another question that's come in terms of application. So Hannah, can any of the devices work for cracked nipples? So like mothers?
Yes, for breastfeeding mums. So I do the Mummy MOT, which is a women's health assessment, which is very in-depth, and I work a lot with mums. Would I use either one of them on the breast area? Probably not. No. If you're thinking it's the LymphaTouch actually lifts the tissue, so it works on positive and negative pressure, so that almost wave type motion. You don't want to stimulate breast milk while you're working on cracked nipples. You want to make sure actually that you're not stimulating that area. You have to be super careful. With cracked nipples, I would get as much cream on there, and also I use cabbage leaves in the freezer. Put your cabbage leaves in the freezer, ladies. Put them in your bras.
Well, that's you
heard it here first. You weren't expecting that, gentlemen, were you?
I'm not going to look at a cabbage in the same way again.
Cabbage leaves. It's an old wives' tale, but you know what? It jolly well worked.
Does it?
Yeah, it did. So yes, help with mastitis, help with things like that. But yeah, as much air and cream on as possible. But I wouldn't use the device.
Right. Okay, that's good to know. I think it's good because obviously, like with any device, any treatment modality, it's going to have things that it's really good for, and then it's going to have things that actually know that it just can't do that, or it has its limitations as well, which kind of brings me into like one of the other questions. I know we spoke about it in quite a lot of depth when one of the times when I met you, Hannah, is that for clinicians who are looking at adding new technologies into their practice, it might be laser, it could be LymphaTouch, could be shockwave, could be whatever. A lot of people look at them as an individual and they just go, right, what's that going to do? Just that.
Yeah.
And they compare it to what they're currently doing.
Yeah.
I've always looked at it as like, how would it, obviously it's an element, look at it individually, but then how does it fit into my practice? Like, what's your approach when you're approached by people like me and Dilesh saying, we've got this amazing device, let's try it? What's your approach to how you kind of make the decision of adding something into clinic?
So first of all, if I'm honest, I think, oh, great, another salesperson, yay, with another device that's going to solve all my problems. No, that I didn't realize I had, yay, I can't wait to answer 700 emails. Now, yeah. Terrible, isn't it? Well, so genuinely, gentlemen, from both of you, the first thing I have to say about both of you is that you're very passionate about your device, your brand, your product, what you have, and actually how you sell it. And actually you don't sell it, if that makes sense. You talk about it with passion and how it would help the clients that I treat. And I think I really like that about both of you already. It wasn't a sell, you need this, and here we go, bombard you with emails every single day. And I think as a clinician, and if clinicians are watching this, you know yourself, you've got busy clinics, you know, you might be answering the phone and booking people in, and you've got clients and you want to do this, you want to do the best for your client, you want to get, you know, good reviews, good turnovers. The last thing you want to do is think, is this the device for me? So I proceed with caution. I do my own research. I look at what you're offering. I speak to you. I'm a big person. You know, if I like working with you, then that's a big tick in the box, which I think helps. You know what, gentlemen, you're both, you know, not bad to work with. So there you go. Oh, you're welcome.
We'll send you the check later.
Yeah,
okay.
yeah, you're welcome. Yeah, it's just double my figures. No. So actually, it's really nice working with you. That relationship, that therapeutic relationship, to say, okay, I've got a problem, help me, and you're right on the phone. I don't understand this. What, you know, why does this do this? You know, you help me. In the early stages with both of you, with Dom, I had problems with the machine. It was sorted out instantly. With Dilesh, with the laser, I had problems in terms of always, you know, clicking the things on, and you know, it was sorted out instantly. Yeah. And that's amazing. That's what you buy into, isn't it? To have that support, and also your evidence, your research, your background. And I do believe, especially with the laser, I can't find, and I've looked, another laser that does exactly what you do to the same effect for the same price. So yeah, so I'm with you on that one. When you say you're proud, I think you should be proud, because you've got a great product there. So yeah, does that answer your question?
Yeah, and I think just to add on to that,
compliment.
Yeah, that was great.
Sorry.
Keep it coming, yeah.
So in terms of, like, so when you're actually looking at the tech though, so you talked about, like, so obviously wanting to be, you're making sure that you're happy to engage with these kind of companies, and obviously the people behind it. When you're looking at the technology itself, so it's more a case of, like, if we go back to LymphaTouch, actually you approached us with Shockwave, didn't you? And eventually, you know, I actually said, oh no, I think LymphaTouch might be a good shout for you. And I think, so I've said, like, this is LymphaTouch. You've got all these different tools, you've got rock tape, you've got all these other things. Do you just look at LymphaTouch and think, right, what's that going to give me? What's that going to do? Or is it, do you look at it as in, how is that going to complement everything else that I do? Is there a gap in my practice that needs this? Is that?
I think it would be definitely the second one. And the reason why I contacted you first of all about the Shockwave is because I had a phenomenal amount. I had weeks and weeks of just treating plantar fasciitis. I think it was in, you know, the first lockdown. People were trying to run, who's never run in their life, and they want to go out for a run, you know, getting plantar fasciitis. You know, that's so difficult as a clinician to treat, and people coming time and time again. So what is out there to accelerate what I'm already doing? So that's why I first approached you. I did my research. I knew that you were the best in Shockwave, so let's get it in. However, you were right. The LymphaTouch far suits the client, the overall clients that I treat. So yes, and the same with the PowerPro laser. I look at my clients. I look at my client base. Who do I normally treat? Okay, I normally treat women. 90% of my clients are women. 80% is my scar work, 70% my scar work. So, okay, so what can I do to enhance what I'm already doing? So how does your equipment fit in with my ethos, with my values, with my treatments, with my outcomes, with my clinical reasoning, with my experience? And you answer all these questions before you even send the email back saying, yeah, I'd like to have a go at that. Thank you.
And then just the last thing in terms of, I know we're talking about a lot about scars as well, is that it's a question that I always get asked. I don't know, Dilesh, if you get the same question as to whether it can improve the appearance of a scar. Now, my response, I want to ask you first before I give you my response. Hannah, which do you focus on first, function or appearance?
It has to always be function. The function of the scar, if you go in with, we can make it look pretty, that is a whole different ball game. So you're looking in aesthetics, you're looking at the beauty industry, you're looking at, you know, make me beautiful. The ladies and the gentlemen that come to me, they're coming in pain, they're coming with restricted movement, they're coming, you know, with emotional distress. You will never get rid of a scar. You will never. The scar has to be there because it's holding you together. You're never going to magically make it disappear and it's going to be skin again. It's forever change from type 3 to type 1 collagen. You're never going to be able to change it back again to make it completely invisible. And it's really important that we stress that to our clients, first of all. This isn't about getting rid of your scar and wave you on your way. This is about helping with the pain, helping with the emotional response, helping with the feeling, desensitization, connecting with that body part again. And, you know, along the way, yes, it might look better. But, you know, if you're scoring your pain 10 out of 10 when you come and see me on your VAS score and you leave scoring it 5 out of 10, then to me, that is so much more effective.
Do you get that question a lot, Dilesh?
Yeah, I mean, obviously they you know, they want to know what clinical benefits are there as their clinical studies behind, you know, what can it actually do for you. But Hannah's living proof right there for me, you know, with what she did with her case study there. And obviously you can see from the pictures that it has massively helped to improve the visual appearance and as well as manage the pain for this patient.
Yeah.
But yeah, it is obviously something that comes up. Yeah.
I mean, obviously, I know I've had patients before where you can take one look at a scar and they say, I want to improve the appearance, and you're kind of like, yeah, that's not going to happen. Like, Hannah, how do you approach patients where you kind of look at it and you kind of go, we can certainly help with the, you know, flattening it off or raising it or something like that? How do you manage a patient's expectation when it comes to their primary goal seems to be just like, I want to improve the appearance, I want this to go away, to actually improving the function, improving the range of movement and that kind of thing? How do you manage that?
You have to be completely honest, don't you? Like I would with anyone. If somebody came in with a frozen shoulder, I'm not going to just say to them, excellent, after one treatment, you're going to be magically better. You're never going to have any problems again in your life. You know, you after the first treatment, you see how they respond, and then you say, oh my, right, okay, I need you back in. I feel this might be a couple more sessions. You know, are you on board with that? Same with scar therapy. You need your client to be with you on the journey and to make it quite clear from the beginning, okay, there will be aesthetic changes in the scar. I'm not as concerned with that. I'm looking at the function. You explain what you mean by that. I want you to be able to, you know, lift your child up now, because you can't at the moment because of pain, or I want you to be able to wash your hair or something like that. You have an objective marker of what you're aiming for. And also, if you come in with 10 out of 10 pain, that's what I'm going to be looking at first. That's what I'm going to be helping you with. And I'm very honest with my clients. I speak to a lot of the clients on the phone before I book them in, just to make sure that, you know, we're singing from the right song sheet even before they enter my clinic. On my website, I'm very honest about what I can provide. It's important to work within your scope of practice as a clinician, as a practitioner. We know this as physios, you know, governed by the HCPC and the CSP, and obviously with my acupuncture and the AACP, you have to be really careful. And I would never want to be felt like I'd been led down the garden path. And actually, you get better outcomes when the client is in control and they understand and they're empowered as part of their recovery journey. And that's what I feel we do at HLP Therapy.
I think that is a perfect way to sum up this webinar. So yeah, on that note, we will close up for the afternoon or the evening. Dilesh, Hannah, it's been a pleasure having you guys on. I think I've got another slide. So if there we go. So for anybody that doesn't know, we've got a couple of upcoming webinars. So the first one is actually, if anybody's on, so we know we have a lot of people that deal with scars that are in the oncology and lymphedema side of things. There's a really interesting paper that came out at back end of 2020 that says we can prevent cancer-related lymphedema by 69 to 81%. It's something that's not really been done massively in the UK. What we've been able to do is get the author of this paper, who's from the Cleveland Clinic, which is the second largest hospital group in the States, on the webinar platform, so you can basically ask him about his paper. So if you're interested, then you can book onto that one. The other one that we've got as well is the roles of lymphatic fluid flow in the immune system function with Professor James Moore Jr. We did one with James or Jimmy Moore last year, looking at the impacts of positive and negative pressure on lymphatic flow. I'd really recommend it if you're interested in lymphatics. Just get registered to that one. Jimmy's a brilliant researcher, so he's fantastic amount of knowledge. So a couple of really exciting webinars coming up. Other to that, we are going to send out an email at the end of this session with the link to the recording and also a survey monkey. So if you could take a couple of minutes just to feedback what your thoughts are on the session, and also any suggestions of future sessions that you'd like to see us present. Otherwise, Hannah, Dilesh, thank you very much for your time.
Thank you, Dom.
Thank you for the opportunity. Thank you.
No, not at all. Obviously, if anybody's got any questions, then please just feel free to email us info@physiequip.com. We'll put you in touch with Dilesh and the guys at Juzo if you've got any questions about the laser system as well. Guys, you're free to have your evenings.
Thank you. Have a good evening, everyone. Take care.
Take care, guys. Bye-bye. Bye.